Good morning, Peter Goertz. I'm a psychiatrist. Let's talk about conversion disorder. Recently, just a few days ago, I saw a patient where this issue came up. And fascinating disorder, as per the DSM, the definition is conversion disorder is a disorder where people have signs or symptoms of problems with voluntary, motor, or sensory functioning, but those signs and symptoms cannot be explained physically by conventional medicine. And doctors can be annoyed sometimes by patients like that because they may get the feeling the patient's trying to trick them. Let's say if a patient comes in and says, on the entire left side of my body, from the midline to the left throughout the whole body, I can't feel anything. The doctor knows medically, as per the way the nervous system is set up, that's not possible. So they may feel that the patient is antagonistic or trying to annoy the doctor. But in my opinion, it's important not to take that personally and to realize that what these patients are doing is not conscious. And as opposed to conversion disorder, factitious disorder is a disorder where people present with signs or symptoms that are intended, that the patient's intention with those signs and symptoms is to assume the sick role. So they want to be taken care of. And that is not the case with conversion disorder. It's under the radar, not conscious. And with malingering, which may also be confused with conversion disorder, people have a goal. Let's say they're saying they're suicidal in order to get out of the cold and be admitted to a psychiatric hospital. Hysteria is a term that has been used for a constellation of signs and symptoms, as in conversion disorder, at least in some cases in the past. And it's interesting, the naming itself could be seen as a sexist term because hysteria is connected with the Greek word hystera, which means uterus, womb. So it's really focused on females, and people like Freud used that term and were focused on treating females who had signs and symptoms as in conversion disorder. And the signs and symptoms can vary. People might have what looks like a seizure, for instance. They may be unable to walk or say they're unable to walk. And one example is I had a patient who had seizures. She had a seizure at work at one point, so quite intrusive into her life. And she was under a lot of stress with work and related to her husband. And if I'm correct, she may have had a history, well, she had a history definitely of a very difficult life, some substance use, maybe also abuse in childhood as far as I recall. And I treated her for some time, for years. And the main thing that we focused on was the psychological part, so psychotherapy. And she came to realize that she would have these events, the seizures, which turned out to be non-epileptic, when she was very stressed. And additionally, though, I did prescribe an antidepressant for her, and she did quite well, and the events became very rare. But occasionally, if I recall correctly, she would have them when the stress became quite severe, and she was not able to cope with it in other ways. So just the patient understanding where these events, in this patient's case, the non-epileptic seizures are coming from, that they're from stress, that can be quite helpful and lead to resolution maybe in some patients, or at least close to resolution, rare occurrences in patients. Another patient I recall was, and these can be quite dramatic presentations, it was in the waiting room of an urgent care clinic, and a lady maybe in her 30s all of a sudden started having a seizure in that waiting room. Of course, that gets attention. And from what I recall, that was also that type of presentation, so probably conversion disorder in that patient also. So what all this is telling us conceivably is if we don't digest, process, or talk about our emotions, our body's going to talk and we're going to have signs or symptoms. And that to me sounds understandable. For instance, any of us might, if we're stressed, have abdominal discomfort, have a headache. So the mind and body obviously are basically two sides of the same coin and very connected. And in this case, with conversion disorder, we're not talking about abdominal discomfort necessarily, but that potentially could be part of it. You know, it is a sensory system that could be connected with sensory symptoms. But in conversion disorder specifically, we're talking about the voluntary motor symptoms, signs or symptoms, and sensory signs or symptoms. And the main focus that's successful seems to be psychotherapy. And one example of getting blindsided, I think all of us can be blindsided by our emotions, and that can have quite dangerous, potentially, side effects for us. So one example is myself. Last year during Mardi Gras, I was at a parade with my wife. We had an argument. She walked away. I was angry. And then three people, it was very crowded, three people pushed into the space where she was standing. And I felt very enclosed by those people, and I wanted to get out of that space. And I tried to, they didn't respond. And then I kind of pushed somewhat through them and ended up tripping over a cooler. And I could have really, my legs got injured quite severely. I could have broken both of my legs at the shin. So again, the principle for all of us, including of course myself, is to learn from things like this, and if possible, avoid them by digesting, processing, talking about our emotions. Thank you.